Hello, so I am going to be presenting about lorazepam, which is also under the name of Ativan, how it's abused, misused, and just the general medication, just an overview of it. So, what is lorazepam? Lorazepam is a benzodiazepine that treats anxiety disorders and insomnia. Sometimes it treats acute seizures, but that's not usually how it's prescribed. A lot of the time, it's just anxiety disorders and insomnia. The effects can last 6 to 8 hours, though the dosaging is not necessarily high either. So it's pretty interesting how this drug differs from others in its class that require a higher dosage to achieve similar effects. How does it work? So, lorazepam enhances the effects of GABA, which reduces the activity in the brain cells it binds to. In other words, it's just pretty good at giving a sedative effect. It slows down your thought process. It throws it not throws it throws off your ability to just think straight. Executive functioning kind of slows down. You can still operate, but it's not really easy to. Lorazepam reduces muscle tone to relax the muscles as well. So if you think about an anxiety attack, a lot of the time people tense up their muscles, and lorazepam makes it so that you don't really need to think about the muscle tension. It goes down almost by itself. Not almost, but it goes down by itself. Ultimately, lorazepam calms the central nervous system. That's why it's so effective. If you look at the picture, which I'm not sure if you can see it, but in Psych 101, we reviewed it, spent about a week or two on it. If you do need a refresher on the whole central nervous system, though, I'm sure you can look it up. I just could not make the picture bigger. But yeah, lorazepam calms the entire central nervous system. So, a bit about the history. So, lorazepam was developed I would say developed, it was synthesized in 1963 by Leo Sternbach, and he was making it because they were aiming to create a safer alternative than barbiturates. They worked, but they had such a high risk of overdose that it was just too dangerous to prescribe it for most people. And that's why when the FDA approved it in 1977, lorazepam quickly became one of the most commonly prescribed benzodiazepines. It was effective. It was not necessarily long-term acting, so since it only lasted 6 to 8 hours, if you have an anxiety attack, it will calm you down, keep you calm for a bit, and then it'll wear off. Or if you're trying to sleep, you will be able to fall asleep, and it will not affect you so much the next day when you wake up. Because sometimes if you're taking a medication that's long-acting before you go to bed, the effects will still be there in the morning, which is not the desired effect for someone with insomnia. So, misuse and abuse. A lot of the time, when somebody is misusing and abusing lorazepam, they were prescribed it. So, they had their own prescription and they started using it incorrectly. Sometimes this is not always on purpose. People might not know dosaging. I know it sounds kind of stupid, but because this medication is such a low dose for very effective results, it's very easy to accidentally give yourself too high of a dose that works for you. In some people, this can lead to polysubstance abuse, which is when lorazepam is combined with other drugs in order to enhance the effect. A lot of the time, when you're thinking about abusing a drug, you're not thinking about someone taking another drug to make another effect stronger, but that's usually how this is. You're usually thinking about someone who's taking too much of one drug and they're getting all these effects from it, but that's just not how this medication works. So it's combined. Consequences of misusing and abusing this medication, any benzodiazepine, and most medications can result in poor occupational academic performance and familial problems such as child neglect or divorce. This is usually because there can be a gap in your memory, You're not really able to think very straight, so a lot of the time you can't really focus on the things that are important to you. And then there's increased injury. A lot of time injury comes from people who are not listening to the instructions on the bottle saying don't operate heavy machinery when drowsy. Because I'm sure, I would say a lot of people, but I feel like almost everybody has seen the label that says don't operate heavy machinery when on this medication because it can cause drowsiness. And when you're drowsy, you don't want to drive. I mean, if you're waking up at 3 in the morning from a nightmare and you're still in your pajamas and 2 minutes later you have your keys in your car and you're driving, you really think that you're going to be full attention capacity? No, that's kind of how this is going to work. Delayed reactions, just everything. And of course, because this is a medication, there's risk of overdose and medical complications. Medical complications is in side effects or anything else that might come alongside another medication that you might be on. So I know that it's not as easy to overdose on a benzodiazepine as it is to a barbiturate, but it's still possible, and people who are taking too high of a dose obviously have much higher of a chance of a medication being fatal as a result. So, challenge and solutions. I'd say one of the biggest challenges is differentiating abuse from legitimate medical use. With a prescription drug, a lot of the times abuse can be similar to normal side effects. So if somebody is, let's just say, having gaps in memory because they're taking too much of the medication, that can also happen if you don't react well to the medication. So your medical provider is not always going to know that the patient is abusing the medication, and that can lead to them getting prescriptions longer than they should be, or finding a different alternative. But the biggest thing here is stigma. Stigma is anything with medical or mental health. A lot of the time, I would say. And because there's such a stigma around addiction, if somebody is struggling with any form of addiction with a medication or they're abusing it, they're not going to seek help for it. They're probably not going to tell their doctor, hey, I'm struggling with taking the correct dosage of this medication. Can we consider something else? No. They'll come up for some other excuse, or what's more likely is if they're asked about it, they will make up an excuse to stay on the medication due to the addiction, and it just continues the whole cycle of the problem. So one way to combat this would be to ensure the medical provider and patient have full awareness of the risks and options before deciding upon a benzodiazepine. So if someone has, I don't know if this is really the correct terminology, but addictive personality, I say this in air quotes because it's used a lot, but may not necessarily be the medical term for it. It can be much easier to have problems with medications that have the possibility of being addictive. I mean, this medication is not inherently addictive per se. Yes, you can get addicted to it, but it's not saying, oh yes, everyone who takes this medication is going to be addicted in one way or another. No. So, a lot of time, you think about it, people with alcoholism in their family, you warn them, if you drink alcohol, you have a greater chance of being addicted to it. Same thing with something like this. If someone's been addicted to medications in the past, or addiction to, I don't know, medications that are similar to benzodiazepines, you may want to consider a different option. So it's important that the medical provider has full knowledge of the medication before prescribing it, and the patient is fully aware of the risks that they may be taking on if they choose to get on a medication like lorazepam. So that's pretty much my whole spiel on benzodiazepines and lorazepam. I hope you learned something, and thank you for listening. Bye.